Did you know that addressing pelvic injuries or impacts is an important key to a smooth birth for your client? Working with the postpartum pelvis can also lead to a quicker and fuller recovery. Tune into today's episode as I share important questions we need to be asking our clients when dealing with their pelvis in the pregnant and postpartum periods.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everybody. Welcome to this episode. Today, I'm going to be talking about birthing positions, and we'll talk about it from the pregnancy standpoint and then also postpartum as well. And what I love to do is when I'm working with a pregnant client is to assess their pelvis, assess their pelvic bones, and see what position they're in, what mobility they have of their pelvis, and in particularly their sacrum. And as physical therapists, we know all about these rotations or left on left, right on right, all these oblique positionings of the sacrum, which would cause the sacrum when you're palpating it to be more prominent in one spot more other over the other. So if we have a left ILA, so inferior lateral angle of the lower sacrum, and that is more prominent on one side, that is a rotation, an oblique rotation of the sacrum. And boy, I used to know how to do all the muscle energy techniques to correct those things. And they're pretty challenging to be able to remember what you're supposed to do and how you're supposed to correct that. And Jerry Hash changed that all for me. Very, very grateful to you, Jerry Hash. Thank you for your contribution to physical therapy care and your mobilizations of the pelvis. That is something we mobilize every other joint in the body. Why don't we mobilize the pelvis? And Jerry brought that to the pelvis, and it's transformational. And I've just taken it to another, not even level, but to in a different direction because of working with pregnant and postpartum and what I found in the postpartum pelvis. And during pregnancy, we want to be asking our pregnant clients, what impacts has your pelvis experienced in your lifetime? So any falls, any traumas, any sports injuries that may have, fall on tailbone, fall on buttocks, falls on the ice. People who have been in sports, ice skating, snowboarding or skiing or horseback riding, falls off of a horse. Um, uh, I had one client who was an ice hockey player in Minnesota, and her pelvis was so hard. There's so many impacts. And, when a pelvic bone has been impacted from a fall, it gets hard and it doesn't have that same springiness that a normal bone does. And so that's one of the things I love helping students feel in their hands is the difference between a normal bone and a hardened bone. And an osseous lesion in the bone is the more technical term for hardened bone. And those osseous lesions come from impacts. And the impact could be sports related, it could be fall related, it could be anything. I had one client who had, she was playing out in the ocean and a wave hit. And when she came down, her knee hyperextended and all that force got jammed up into her pelvis. And I really felt it in her sacrum, and her sacrum was super hard. And I would release her sacrum, and she was complaining of Braxton Hicks, having Braxton Hicks 20 to 30 times an hour. And on days she'd come in and I'd release her sacrum, they would go down to 1 an hour. And so I feel that that's from the connection to the to uterosacral ligament. And that is what is creating that irritability of the uterus, as the uterosacral ligament might be being activated, which is activating the uterus. That's my theory anyway. I have no idea exactly what's going on, but when you release the sacrum and the Braxton Hicks contractions decrease, Makes me wonder. There's definitely a connection there. So we need to understand what our pregnant clients are bringing to this pregnancy in their body, and how that's going to impact their birth. So we want to ask the questions. What have you experienced? Any falls, any traumas, sledding injuries, sledding accidents when they were younger, that could definitely have an impact on the pelvis. This is not something that we want to scare our clients away and say, oh my gosh, you've had this fall, it's going to impact your birth. No, we don't want to scare any of our clients. We want them to be aware. When they're aware of what they're carrying in the body, then we can work with it. It's when we don't know what's going on, you're going into birth blind. And as physical therapists, as body workers, we can palpate the structures. We can get a sense of what's going on. We can work with the bones and the muscles and the tissues and the ligaments and everything to try and make effective change. But when that change is not able to be made, you're working with it, but there's no change made in the tissues, then we need to take that information and see how they are presenting, how is that going to impact their birth, and what can we do about it. When the sacrum is out of place, or one side is more prominent, I shouldn't say out of place. I don't mean that. When the sacrum is not in a neutral position and everything's nice and even, we have maybe an ILA that's more prominent, or maybe a sacral sulcus that's deeper on one side more than the other. We can instruct the birthing team to add pressure to the most prominent aspect of the sacrum during labor, if labor stalls. Like, we don't want to go in assuming labor is going to stall, but if it does, then we can say, I usually get out a Sharpie, ask my client, is it okay if I put a Sharpie, a X on your sacrum here? And they're like, sure, no problem. And so I put an X on there, and then I tell the team, press here during labor. And I've been told by several doulas that has been super helpful during the birth, and that it did actually help. So my sense is that sacrum needs to be nice and even in order to be able to do the motions it needs to for babies to pass through. And so that's why we want to be aware of what's going on. And then we can take it another step further and say, well, your pelvis is doing this position. Like, let's talk anterior rotation. Some people may have they may have a shorter leg. If one leg is shorter, that shorter leg, the ilium is going to anteriorly rotate to lengthen that leg. And so during labor, if we've got this anterior posterior rotation of the ilium and we're not able to correct that, then we want to take that information and go, okay, if you are wanting to bring one leg back and up to open up the pelvis, start with this leg first. The one that's anteriorly rotated, that needs to be more posterior. So let's bend that leg up. Let's do a couple of contractions in that leg first and see if that helps. Because a lot of times the labor team's just guessing, and they're just having their moms, do one leg, then the other, and then one leg, then the other. And the person may need that. There's nothing wrong with that. And if we know they have an anterior rotation, if we try to put the other leg up, they're going more into that dysfunction. So we want to advise them, hey, try this leg first and see if that's not better. So our whole goal here is to help minimize the time that someone is in labor and really support that baby's passage through, and understanding the mechanics of the pelvis and knowing what this person's pelvis is doing. Then we can help guide them and say, okay, you are really locked down on your right side and we cannot get it to move much. Your sacroiliac joint on that right side is just not moving. So if you're laboring, lay on that right side, because it's going to be anchored down anyway. Let's make sure the side that can move is going to be on the upside, so that it can move more. If we put them on their left side, now the locked down side is the side that has to move more to get that baby on out, and it may make it more challenging. So this is our role as body workers, as physical therapists, occupational therapists, people who can palpate the muscles and the bones and see what's really going on, and take that information and then use it to help guide someone for their labor. And, my whole goal is to help my clients tune into their own body and get a sense of what their body's wanting, what the baby's wanting. And that can be super um, helpful as well, that they may go into some of these things automatically, which is great. If someone's not as attuned to their body and we know mechanically this is what's going on, we want to help guide them. One caveat I do always try to make known to my client is that there is not a position in birth that I tell them to avoid, except for if their tailbone is really close to their pubic bone. That's one of the things that we learned to palpate in my pregnancy course, is how far away is the tip of the tailbone to the pubic bone. And if it's really, really close, then I am telling my clients, stay off your sacrum, stay off your back. If you have to get an epidural, make sure they roll you over to one side so that sacrum has the ability to go backwards. But there is not a position. I'm like, I never tell someone, oh, don't lay on your side, don't do this, because you never know what needs to happen in order to get that baby on out. So be careful with your words when we're talking to our pregnant clients, because we just don't ever want to create doubt in their body and their body's ability to birth their baby. So now let's talk about postpartum and why it is so important for us as practitioners to ask the question, what position were you in when the baby came out? We need to know this information. And if you're not asking it, that tells me that you're not interested in what the pelvis is doing after birth. And the pelvis is highly impacted from a birth and needs our support in helping to bring it back to its original position, especially with our moms dealing with pelvic pain, low back pain, or heaviness, pressure in their vaginal space. All those are signs that the pelvis is not in a happy position and needs support. So you should be asking, what position were you in when the baby came out? That's going to tell you what pressures and what impact the bones of the pelvis endured during the birth. If someone was in side lying, the side they're laying on is anchored. It's not moving much. The top side is going to have to open up more. And so what I love to do is take what my clients tell me is like, oh, I was standing, but I had my right leg up on the bed or on a stool. I'll be like, okay, that's putting her right pelvis on a posterior tilt, and it's probably unweighted. So that right ischium, I wonder if I'm going to find that right ischium splayed. And I have to tell you, I'm 100% accurate every single time, because I'm sensing into what's happening mechanically. Yes, some people could say, well, you're finding what you're looking for. However, I'm testing mobility, and I'm also looking at positional position of the bones and mobility, and it correlates. It completely correlates. If someone tells me they birthed on their right side, I'm going to find the left ischium more splayed. Whatever leg was bent up, that ischium is going to be more splayed out. And we don't want to ask the question, what position were you in during your labor? Because they're probably going to be in a ton of different positions. It really only matters what position they were in when the baby came out. And if someone is on their back, you want to add, and their legs, I always ask if they were on their back, so they had an epidural, they were on their back. I always ask the question, who was supporting your legs? How were your legs supported? And if it were two different people, did they support them? Did it feel like they were supporting your legs equally? And a lot of times there's not. I had one client that came to see me, and her just whole pelvis and left or right hip just was funky. And I'm like, what happened in your birth? And she goes, oh, there was a nurse that was like, she was a new nurse and she was supporting that right leg, but it was like she didn't care and she didn't want to be there. And she just really wasn't supporting my leg. So we had to replay that and reprocess that. And that was being held in that tissue. And so it's super important to get a sense of what was going on during that birth, during that process as baby was coming out. A lot of times you get those really excited dads who are like holding their knee up by their ear, and then labor nurse that is more relaxed about holding the leg. So you've got this torquing happening of the pelvis as baby's coming on out, and that tends to stay in the pelvis at post-birth. So that's why it's so important for us to be assessing the pelvis and making sure that we know, or that we're addressing what's being held in the pelvis after that baby came out. And when you get things back into place, everything's able to function so much better. And so I'm going to continue to tweet this message, to get this message out into the world until more people start listening and understanding this, because it's amazing how many people go, well, that just makes so much sense. But yet there's so many people that are resistant to hearing this message. So I'm not going to stop until it's a common knowledge, common theme, common that we all are looking for after after a baby comes on out. So all of us doing postpartum care need to understand the impact that birth has on the pelvic bones and what we can do about it to help bring them together. If you are new to this podcast and you haven't heard me before, please check out my YouTube channel. I have a link to how to close the bones of the pelvis after birth. It's an exercise using the adductors and abductors to help bring the bones back to midline. And that's super, super helpful. I really wish every postpartum person knew how to do that right away. Let's make that common knowledge, common occurrence. They could do it in their bed at the hospital. So we need to get hospital nurses, labor nurses to know about this. We need to get PTs, OTs in the hospitals to know that this is a simple exercise that every single person could do right after birth, would save them a ton of pain, dysfunction, and problems in the postpartum period. If we could just help bring those bones right back to where they were before baby came out, it could change our clients' lives. So let's get the word out there. Please share this podcast with other people. Let them hear about this message, and let's spread it far and wide so that we can better support our moms after birth. Thanks so much for listening in. Here's to smoother births and faster recoveries, and I'll see you all in the next episode. Take care. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.